Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very great pleasure of welcoming Rachel Taylor out of South Dakota. Rachel is a former ICU nurse. She's also worked with veterans, and currently she's the director of nursing for the Archer Review. So, Rachel, welcome.
Thanks for having me. It's good to be here.
It is my absolute pleasure. It's my absolute pleasure. First of all, though, what brought you into nursing? What inspired you?
Yeah, I come from a family of nurses. So my
Ah,
grandma's a nurse, my mom's a nurse, my aunt is a nurse. I have at least three cousins that are nurses. So family of nurses. But the funny thing is, I never asked one of them why they went into nursing, why I became a nurse. I was 12 and my appendix ruptured in an ER waiting room and my pain went away. And so I sat there a really long time. They were like, oh, she's better. Let's leave her there. And I ended up super sick. I ended up septic. I had to get my stomach pumped. I hallucinated all the things afterward. And I had one nurse there that my parents left for just a few hours to get a break. And she left me in the bathroom the whole 2 hours they were gone. And it really showed me that I didn't want to be that. And we had a nurse practitioner come in, amazing. And she just changed the whole experience of me being there. And I was like, I want to be like that to someone
yeah.
else when I am older. And it was funny because I was 12. And ever since that day, I said, I'm going to go into nursing. I don't know what I'm going to do in nursing, but I'm going to go into nursing. And so as a 12-year-old, I started thinking about in high school, how can I prepare myself to go into nursing? So when I was 16, I started working at a nursing home. And then I just continued to push through of what advanced classes can I take to set me up for nursing success? And that was just always the route I've wanted to go. But it's funny that I never thought to ask my family of nurses, what they thought about it.
I was just about to ask you why not? Why not? So, okay, so you didn't ask them, but when you said, okay, I'm going to go into nursing, did they have any advice to give?
Not really. They said it was a great thing to go into. There would always be a job for me if I needed one, and wherever I went, there would be a role. Um, and I think they were all just really supportive. That's what my family did. So they were all for me doing the exact same thing. I don't remember them, saying, yep, this is 100% the way you should go, or saying, no, this is, another route you could take instead. They were all just supportive and I could
Okay.
call them when I was in nursing school and be like, oh my goodness, I'm really struggling. And they would be like, okay, this is what you got to do. So it
Mhm.
was a good support system for sure.
Okay. All right. So you had that support system. You were laser focused on becoming a nurse. You had the patient experience, both good and bad, in a short period of time. What challenged you when you got there?
Yeah, so I think for me, I do have a little bit of a perfectionism issue. If I were to say my weakness, it's that I have to be perfect in anything that I do. I'm getting a lot better at this. So when I was in school, I couldn't just pass a test. I had to ace a test. If I missed something, my thought was, well, I don't want to miss that when I get to patient care. And so I would really focus on scoring as well as I could on every single test. I really focused on if I missed something, what did I miss? Why did I miss it?
Right.
And how is that going to impact me when I get to the floor and when I start practicing? Um, and I think that's just been my mindset ever since I started nursing school was to have that motivation. Because if I didn't have it in school, it could impact a patient I had later on.
Yeah, 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 exactly, exactly. And so I started by saying you have worked in the ICU and you worked with veterans. Did you go directly into the ICU?
Mm-hmm. Yep. So I did my capstone in the ICU, and then it was a smaller ICU. It wasn't a big one. We were in a small town outside of the city, and so we did have higher acuity that we would send patients to the city. Except for during COVID, when the city was full, we were the option. And so I started right into the ICU. Yep.
Mhm. Did anyone discourage you from doing that?
Actually, several instructors I had, they all said I needed to go into med surge first. It was very clear that that's what all of them had done. And so they wanted me to do the exact same that they had. Start med surge and then you can decide.
So having drowned out the noise and done what you wanted to do,
Mhm.
um, what is your opinion? Do you think that you did the right thing, or maybe you should have listened?
I think I did the right thing. And my reason
Uh-huh.
why is every unit you go to, it's so vastly different. I would
Yeah.
float, and I don't know that working one unit truly prepares you for how another one is going to be set up. I think you have to learn that. The
Hmm.
pace of ICU when I would float to the ED, I'm like, wow, this is totally different. How I
Yes.
think is totally different. And so, honestly, I think the best place to be is where you're passionate, where you feel fueled, because otherwise you're going to burn out. And then I think you get a bad taste for nursing if you're not doing what you love.
Yeah, yeah. And you just said something really very important. You said how you think is totally different.
Mm-hmm.
I think a lot of us take a little bit of a time to really learn that we think that nursing is nursing is nursing is nursing, and maybe in a sense it is, but there's very different that you have to fit in very differently in very different spaces, even though it looks like you're in the same place, you're in the same hospital, you're taking care of patients overall kind of in the same, you have the basic principles,
Yep.
but your thought process sometimes has to be different.
Yeah, absolutely. Yeah, when I'm in the ICU, right, I'm thinking really in depth, every single thing. ED, you don't have time to be doing
You
that.
know, right? Exactly. Exactly. And so you moved to take care of veterans.
Yeah, so I actually miscarried twice when I worked in the ICU. And at the time, it was during COVID that I had miscarried. And so I couldn't just take off. We didn't have the people for me to take off work. I was charging. And so I just kind of worked through my miscarriages. Later on, realized that wasn't the best and I needed to take care of myself. And so I stepped away from ICU nursing, which I never thought I'd do. I thought that's what I was going to do every day until I retired. But there were other plans for me in the nursing profession. So I stepped away. I worked with veterans, totally different pace, working with veterans compared to the ICU for sure.
What do you think you'd like to see change in nursing, though?
Yeah, I think really the biggest thing is more support. I remember when I was nursing, I started charging my first shift off orientation because we just didn't have enough nurses and I was not prepared for that. And my number one thing I kept thinking is, who do I go to if I don't know the answer? Because right now I'm the most experienced person in on this floor, and we don't have someone. We had at the time there were lots of travel nurses coming in. We would have nurses floating, and again, it was a smaller acuity hospital, but at the same time, lots of responsibility. And I wanted to have someone who was there in case I needed them. And we did have, our house supervisor that could come help me if I absolutely needed it. But I think more support in that because I wonder how many nurses get in that really stressful situation and they walk
Yes.
away because they don't have someone there to support and encourage them in that moment. Where if they had someone right next to him saying, hey, you're doing this right, your thought process is right, keep doing this, or hey, that could be really dangerous, let's try this instead. If they had someone guiding them and they felt support and encouraged instead of judgment or the eating your young, I wonder if more nurses would stay at the bedside longer.
Yes. And you said that it's a lower acuity hospital. But regardless of what the acuity is, you are responsible for someone's life.
Exactly. It was exactly that. I mean, we had mechanically
Yeah.
ventilated patients. We would take care of crashes, and we didn't have an ICU doctor right at bedside. In the city, it's great because you have your ICU doctor right there. If you need them, there's
Hmm.
someone who can be there very quickly. I would have to wait, or the doctor would come in if
Which,
there was an
yeah,
emergency. And
yeah.
so you were the resource. You didn't have a team for everything that happened. You were the team, you and the other nurses you were with on that unit.
Yeah, yeah. And that that makes you grow up fast and gives you ulcers along the way.
Yes, that is the truth.
Oh my goodness. So what so I'm guessing then that that's one of the things that precipitated you and pushed you into um becoming part of the Archer Review, helping you to help prepare nurses. As you said pre-recording, it was not just working towards the test, but developing people. So how does that work?
Yeah, so I actually started off in education with I worked for a college that was close to where I lived at the time, and their pass rates were low. And they're like, Rachel, we really need help getting our pass rates up. And I was like, okay. And so I started working with students from pre-nursing and teaching them time management, study skills. How do you be a nursing student? Because it's way different than undergrad before nursing school.
Yeah,
And we improved our pass rates significantly. Test scores were the highest we had seen in a long time. And one of my students, actually, who had failed before I started, failed the NCLEX, said, Rachel, I'm going to buy Archer Review. It's the only thing I can afford. I've tried everything else out there, but I'm going to try Archer. Passed in the minimum amount of questions on their next attempt after trying everything that was out there. I was like, what is this product? I've not heard of it before. And so I had several more students use it. They all went to pass. And I was like, wow, this is amazing. So I reached out, and at the time, their CEO responded to every single message that they got because it was a pretty small company. And they were like, hey, are you looking for a job? And I was like, no, not really. But ended up making that connection and working for them shortly after that had happened, and started off just as a contractor tutoring. And what
mm,
really fuels me is taking a student who they don't think they're going to get there. They don't think
mm,
they're going to become a nurse. They have had every, road block them, and they're like, oh, I'm not going to get there. And I come in and offer support and encouragement, and then they feel like there's no limit to what they can do and that they can accomplish what those dreams are. That is my favorite moment of it,
yeah.
because I think when you're a student, sometimes you don't have the support, or you don't know how to get the support if it is there. And so a big part of what I feel like we do is, yes, we have the whole test prep aspect of it, but when we really truly support them at the foundation, that's what helps them thrive the most. When they feel encouraged and heard, and they feel like it's attainable for them, they really go on to be successful.
And that thing that you poured into them at that stage will come back again and again and again over the course of their career. That sense of, you know, I can do this. I can do this. I need to take a breath up, but I can do this. Yes.
Yeah, one of the big things I teach them is mindset, right? Like, we get to choose, are we going to fuel self doubt or self confidence? We get to make that decision every single day. And so I really work with these students to, how do we continuously work to fuel the self confidence, but then also limit the self doubt, because everyone's going to have negative thoughts here and there. I think it's human nature, but how can we limit those and really work to fuel our confidence? Because that's when we're going to reach our goals. If we constantly tell ourselves we can't, we're not going to do it.
Not
But
going
when
to.
we start saying, hey, I am capable, I am worthy enough to do this, that's when we start reaching those goals.
Yeah, yeah, yeah. And that for many of us is quite a hurdle
Mhm.
because we have had those negative thoughts running in the background for so long on so many levels that, pushing them aside. Doctor, who's it? Dr. Amen, I think, who calls it the ants, always negative thoughts. Um, Pushing them aside can be work in itself.
Mm-hmm. And it's funny, it's one of the things I struggle with the most. I advocate, I teach on it all the time, and yet I still struggle with it. But I think that's why I love teaching on it so often. Test
Yeah.
anxiety is another one. I've seen
Hmm.
so many great nurses struggle with test anxiety, and they just can't get through the test. And if we help them through that, then they can really showcase the knowledge that they have. And it's kind of the same thing. I remember when I was first in the ICU, there were things that made me anxious, and I had
Hmm.
to work through that anxiety despite it being there. And so really giving students the tools to do so that they don't freeze. Because as nurses, we can't freeze all the time. It's not an option.
Exactly. Who can freeze? Who has time to freeze? The
Yes.
luxury of freezing.
Yes, exactly. And so if they're experiencing that on test, it's likely they could experience the same thing as a nurse. So let's provide them tools early to not just help them through school, but help them as they start practicing as well.
Yeah, yeah. That's awesome. So here's the thing I like to ask nurses, regardless of where they are, is what would you say is your greatest achievement so far?
My greatest achievement. This is a tough one, I think, for me, just because I'm not someone who likes to say, wow, look what I did.
And
That's not
that's why
my
I asked it.
personality at all. But I would say in the role that I'm in, I've impacted well over 30,000 nursing students, probably more than that at this point. And what's really cool for me is that impact in nursing, like all of those students going in with confidence and going in to care for patients in so many different ways. I would say that is my greatest achievement. And the team that I have worked to build, I have a team that works under me, watching them thrive, watching them educate even better than I can. It's like, wow, look at them go. And I love that because the more we fuel into other people, the more they can fuel into others. And it really has this ripple effect. And I find that even with students, I've had a student actually who used Archer Review, and I met them at NSNA this year, and they said, guess what? I'm an educator now myself. And it was like, wow, this is so cool to see. And I think why that was really an aha moment for me is when they see us love something, they're like, oh, I can do that too. And one thing that I used to think was I would be an educator when I was 65 years old. I'm an educator in my late 20s. And so I think it really showed me that it doesn't matter when in your career you do it. If you want to accomplish something, you can do it. And so that would be one of my greatest achievements. Did that answer your question?
Absolutely, absolutely. And I ask it because we tend to not to recognize the things that we do and how important they are sometimes. And I think that every now and then probably we don't have to be what's the word I want to use? We don't have to be conceited about it. We don't have to be always blowing our own horn. But
Yes.
there are times when what you have done every now and then, it's good to look back and say, wait a minute, did do that. I did do that because as much
Yes.
as we try to pour into others, we've got to recognize our little achievements too, and sometimes give ourselves a little pat on the back. And
Yes.
sometimes we do need it.
Yeah, absolutely. Yeah, I would
Yeah.
say watching new nurses not just make it to the new grad period, but actually thriving where they are
Flourish.
at and really building a legacy, not just in what I'm doing, but what I'm helped growing. That would be
Mhm.
my biggest thing. Like, I'm excited to see what Archer becomes and how many students we can support really reach their goals.
Okay. So I was going to ask you, you started to answer the question I was just about to ask because I was going to ask you now, what is your big vision for Archer Review?
Mm-hmm. Yeah, I would say to really continue building. I want to see where we're supporting nurses from the moment they're thinking of going to nursing school all the way through. Right now, we do have, pre-nursing resources, advanced practice resources, but really create this community that's from day one and goes through all the way through their nursing careers where they feel that support. Um, I think that is my biggest thing because we've seen the need for nurses globally. There is a massive need for nurses. And I think part of this is we have so many trained nurses that can't pass the NCLEX. So let's help them pass that. But then they get there and they experience burnout. They get there and they need that support. And I really want to see Archer Review be able to provide that support as much as possible. And the other thing too is like for nurses in general, I wanted to feel safe for nurses to be able to ask questions and to say, hey, I don't know how to do this. Can someone else help me here? And
Mhm.
grow people and not just expect them to know everything day one.
Yeah, yeah, I and you- that's a very a very big thing because all of us, every single one of us, in and out of healthcare, recognize how fast and how quickly it's evolving.
Mhm.
And yet, in many instances, we expect people to know everything, and those two are just not congruent,
Yep,
you
exactly.
know. So, with all of that, what advice do you give when
Mhm.
someone says, "Rachel, I want to be a nurse"? What advice do you give?
I would really say that your compassion is your strength. And if you have a moment of self doubt, go back to your why. Why do you want to be a nurse and let that fuel you? Because there are going to be moments that you're going to be like, oh, did I make the right decision? Is this what I want to do? Or this test is really hard. This class is challenging. And in that moment, remembering the why of, hey, this is why I want to become a nurse. And when you let that fuel you, it gets you through those hard moments. I know when I was working in the ICU, I had plenty of hard moments and it was like, okay, this is why I want to be here. So that really helped push me through those moments of doubt.
Yeah, yeah, that is the one thing that makes you say, regardless of what's happening here, I've got to stand firm,
Mhm.
got to find the way around this or through it or whatever.
Yeah. And I would say
Yeah.
too, be the support that you wish you had if you didn't have it. How can you be what you wish you had when you were in those shoes?
Exactly. So we've talked a lot about, burning out and all of that. And of course, we talk these days, everywhere you turn, we're talking about self-care. What do you do to take care of you?
Yeah. So this is something that I've started to work on recently. I did not have this skill when I was a new grad nurse. I showed up when they needed me. If they called me in, I was headed to work.
Yes.
And what I've really learned is that self care is not selfish because if I don't take care of me, I can't take care of my patients well. And so, really, what I found is creating boundaries. Is how can I create boundaries to where I am having joyful experiences outside of work, where I am filling my cup because we cannot pour from an empty cup. So, for me,
Hmm.
my family, we really like to go hiking around the Black Hills. That's something we really love to do. So, how can I be doing that more often? And how can I make sure that I'm getting more time with my kids and my husband? Because when I'm doing those things, I do better when I'm working. If I decide, oh, I've got these extra projects, I'm going to have to work through the evening, get up at 4 a.m. and start work the next day, and I don't take that time for self care, it takes me longer to do my work. I'm not as successful in it. And so it really shows that when we take a moment to step away, that we really can maximize the work that we're doing. And I even see this in students too. If they
Yes.
study for 8, 10 hours a day, they're not usually as successful as those that are studying for 5, 6, and then
Yeah.
taking time for that
Taking,
self care.
yes, indeed, indeed. We can oversaturate ourselves with with the focus and what we need to do. And forget we get lost in it sometimes.
Yeah.
And you said that you're working on it. Just I am still working on
Yeah.
it.
I think I'll be working on it forever.
And that's one of the things that I think that we really need to shift. Because I go back to my own nursing career and my own nursing school and thinking about self-care, I'm telling you that if I mentioned self-care, which I never did anyway, because it didn't even occur to me, but had I mentioned that, I know that someone would have looked at me like, what are you talking about? Who, this was not
Yeah.
what you're here to do. Take care of you. Why?
Mhm.
So I really wish I want us to shift that and have students really, even at the beginning, as you mentioned, day one and pre-nursing, start thinking about taking care of themselves in the whole context of taking care of other people as well.
Yeah, absolutely. Like I said, we cannot pour from an empty cup. And I think it becomes evident in nurses when we try to. And so I think the more we fuel ourselves, the more we can really show up for our patients.
Yeah, yeah. So I have one last question.
Yeah.
If you could tell me in one word, you deal a lot with students and nurses, and if you can tell me in one word what you would think of as the most essential quality of a nurse, what would that word be?
I think it's being present.
Being
Presence is
present.
really so important because what patients look for, what students look for is consistency. And if I'm not there when they need me, if I'm not present and I'm not showing up fully for them, they're going to know that. But when I'm present and I'm advocating for them, they really see that. And that's where that rapport is built, is when you're there when they need you.
Yeah, yeah. And you said quite rightly, they will know it.
Mhm.
Just as your patients will know it, they will know it. So yes, absolutely important to be present in them, fully present,
Yes,
fully
absolutely.
present. Yeah, indeed. Rachel, thank you so, so much for this conversation. Any last words you would like to leave us with?
That was everything. Thank you so much for having me. And I enjoyed being here today.
I enjoyed having you. Thank you so much.
Yes. Have a great day.
You too.